Welcome to Understanding How to Navigate the Health System, a Guide for Citizens. This is the third module, where we will cover care for select treatments. My name is Christina Madison, and I'm a scientific lead at the McMaster Health Forum, and I'll be walking you through this module. To understand how the Ontario health system is delivering care for different treatments, we will look at three different treatments that take place outside of the typical model: prescription and over-the-counter drugs, complementary and alternative therapies, and dental services.
Ontarians are required to pay through private insurance or out-of-pocket, namely prescription and over-the-counter drugs, complementary and alternative therapies, and dental care. For prescription drugs, and to a lesser extent in dental care, the provincial government administers a number of programs to assist Ontarians in accessing these treatments. No similar program exists for complementary and alternative therapies, though in some instances, private and employer-based insurance plans provide limited coverage for these therapies, such as for chiropractic or massage therapy services.
Prescription and over-the-counter drugs, when public and private spending are combined, are the second largest category of health system expenditure, behind hospitals but before physicians in Ontario. The majority of prescription and over-the-counter drugs are paid for by private insurance or out-of-pocket, with government funding, or drugs provided in hospital or covered through programs funded by the provincial government, the Ontario Drug Benefit Program, and selected drug and/or disease-specific programs. Complementary and alternative therapies are increasingly being used by many, but they are often delivered outside of the publicly funded health system. Chiropractors, homeopaths, massage therapists, naturopaths, and traditional Chinese medicine practitioners are regulated health professionals that provide complementary and alternative therapies. All work in private practice and do not receive funding from the government. They are paid for through private insurers or out of pocket, and no government funding to cover these therapies. Dental services are treatments which are often taken for granted, but they are delivered largely outside of the publicly funded health system in Ontario. The majority of dental services are paid for by private insurers or out of pocket. A small amount of dental services are publicly funded. These are dental surgeries performed in hospital and dental services covered through provincial and municipal programs. For example, Healthy Smiles Ontario, which provides dental services to children and youth 17 years old and under from low-income households.
The Government of Ontario provides coverage for all drugs administered in hospital and provides additional assistance for prescription and over-the-counter drugs through the Ontario Drug Benefit Programs. These programs assist eligible Ontarians, including the elderly, recipients of home care, residents of home for special care and long-term care homes, and those on social assistance, by covering most of the cost of the prescription drugs listed on the Ontario Drug Benefit Formulary. Additional programs are available to help cover the cost of drugs not on the formulary for individuals with very high drug costs and for those requiring select drugs for cancer and a range of other serious conditions. Eligible patients are typically required to pay a co-payment, which can be a flat fee of a few dollars, and at times a deductible, an amount before coverage kicks in, just like with car insurance. In Ontario, dental care is typically paid for out of pocket or through private insurance. The Ontario Health Insurance Plan only pays for a small percentage of all dental care, such as dental surgery performed in hospital, and select public health programs such as water fluoridation and services aimed at children living in poor households and people living with disabilities.
The Ontario government pays for care provided in hospitals or by physicians at the point of care. Some prescription drug and dental services are also covered by the province. However, most prescription and over-the-counter drugs, dental services, and complementary and alternative therapies are covered through other means, like private insurance and out-of-pocket expenses. And because most Ontarians pay for these services themselves, they may choose not to access these products and services. This concludes the module. Up next, we will review how the Ontario health system delivers care for different populations.